This podcast is sponsored by Talkspace.
Last year, I went through many different life changes. I needed to take a pause and examine how I was feeling in the inside to better show up for the ones who need me to be my best version of myself.
When you're navigating life's changes, Talkspace can help. Talkspace is the #1 rated online therapy, bringing you professional support from licensed therapists and psychiatry providers that you can access anytime, anywhere.
Living a busy life, navigating a long-distance relationship, becoming a first-step father, Talkspace made all of those journeys possible. I could speak with my therapist in the office. I could speak with my therapist in the comfort of my home. I was never alone.
Talkspace works with most major insurers, and most insured members have a $0 copay. No insurance, no problem. Now get $80 off your first month with promo code SPACE80 when you go to Talkspace.com. Match with a licensed therapist today at Talkspace.com. Save $80 with code SPACE80 at Talkspace.com.
Welcome to IgAN Journey, the IgA Nephropathy Foundation's podcast. Here, we share information, tips, stories, and inspiration for living with IgAN. Using the power of our growing patient community, we are focused on funding research and building a network of support and ultimately finding a cure. To learn more about IgAN, to get involved, or help fuel our mission with financial support, visit IgAN.org. Welcome to our latest episode of IgAN Journey. Today we are joined by David Walter, doctor of osteopathic medicine and psychiatrist, who works with patients managing chronic illnesses like Crohn's and colitis and many others. David, who lives in Portland, Maine with his wife, is also an ambassador for the IgA Nephropathy Foundation in Maine, where he's helping to advance our mission, raise awareness of IgAN, and connect other patients and kidney care teams. Today, we're going to talk a little bit about dealing with the emotional side of living with IgAN. David, thanks so much for being with us today.
Thank you for having me, Amanda.
So the realities of living with a chronic illness like IgA nephropathy can feel overwhelming. The worry that comes with managing it, obviously lots of doctor's appointments, frequent blood and urine tests to worry about, medications, medical bills, and dealing with insurance companies and prior authorizations. And in some ways, it can feel like a full-time job, which can just pile on stress. But we say, as a foundation, as you know, that you're not alone, and there are definitely things you can do to help. First, why is it so important for people to really tune into their mental health when living with a chronic disease like IgAN?
Well, by focusing on mental health, people can enhance their ability to manage whatever their chronic disease is, which will lead to better health outcomes and a better quality of life overall. Mental health definitely influences physical health. Stress, anxiety, depression, all can exacerbate chronic diseases, making symptoms worse and making recovery harder. For example, I was part of a study called Inflammatory Bowel Disease Partners, and part of that was filling out a questionnaire every 6 months. So they were able to get a lot of data on IBD patients. And one of the studies, and these are all published studies that came out of this, was if they looked at episodes of depression at point A, people were more likely to have an IBD flare 6 months later. So that was just a perfect example of how our mood or emotions can affect our chronic illness. Also mentioned quality of life, which is mental well-being, positive mental health, and individuals manage conditions better and maintain a higher standard of living overall. One thing I do every morning, and I have my patients do sometimes, is a gratitude practice. And I do a gratitude practice every morning, which essentially, I'm Buddhist, so mine's tinged with a lot of Buddhist stuff, so I won't go through the whole thing. But essentially, when I wake up, when I'm laying in bed, I'll just think to myself, I'm grateful for being alive today, and hopefully I can be benefit to other people.
I think that's super important. Actually, I know you missed Spark this year, but one of our main speakers talked about he's the wins, right? And he's winning if he's gotten up out of bed and he's breathing, right? So it's like being grateful that he's just alive.
Exactly. That's how I start every day. Then I'll do 3 deep breaths. So I think most people at this point know how to do belly breathing, but it's very deep diaphragmatic breathing. So inhale, hold it for a second, let that out, fully empty everything, and then just sit for a few seconds, and then do that 3 times. Then I will just let my mind rest, let my thoughts go. And once I do that for a minute or so, I just cultivate an attitude of acceptance for life, and not just life in general, life as it is.
Yeah.
Because there are things that we would love to change that we can't. There's a lot of acceptance about having chronic illnesses.
Okay.
The other thing I think about when I am thinking about mental health is support networks, keeping support networks such as the IgAN support group that's on Facebook. Behavioral factors, diet, exercise, medication adherence are all super important in managing our chronic illnesses and addressing and preventing, if possible, comorbidities such as depression, anxiety, which are very common among us with chronic illnesses.
Well, and you talk about depression and anxiety exacerbating or worsening chronic conditions. I would imagine that part of that is because if you're feeling down and depressed and kind of not feeling it like you have any sort of locus of control over the disease, then you're less likely to be adherent to your medications, eat a good diet, right? I would imagine it's a bit of a snowball effect too.
It is. They all intermingle.
Yeah. And I should say, I know we started out by talking about the importance of kind of tuning into your mental health. We actually had developed a tool that's on our website, IgAN.org, for people to be able to kind of sit, print it out. You don't have to share it with anybody if you don't want to. The ideal is you would share it with your care team in terms of how you're coping with your IgAN and any other conditions that folks have. So you mentioned belly breathing, gratitude, and kind of creating an outlook of acceptance. What are some other strategies or tips to help calm the mind or feel more in control of your illness?
So one that is core to most of my patients and myself as well is a mindfulness practice. But I started meditating when I was a teenager, actually to deal with IBD pain. And I have done that since. I had pretty much every day. There's got to be a good reason if I'm not meditating that morning. And honestly, I can't imagine how I would have handled all this if I didn't have that really firm practice built into my life. So mindfulness practice, regulating emotions are very important because our emotions it's easy for us to get dysregulated when we're struggling with all these physical and emotional things that are being thrown at us on a day-to-day basis. The parts that go into regulating your emotions are being self-aware of the emotions. Sometimes people know they feel something, but they're not knowing what they feel. So it's good to notice your emotions. With the kids I work with, we'll call it identifying and naming your emotion. And that's a good first step towards emotion regulation. So once you name it, next thing you want to do is just be mindfully aware of everything around you. The third thing, which I want to spend a minute talking about, is called cognitive reappraisal, which is a linchpin, something called cognitive behavioral therapy, which if you've been in therapy, most people have done some sort of cognitive behavioral therapy. Yeah. So cognitive reappraisal, it will alter the way we think about things. It's a psychological strategy. It involves changing the way we think about potentially strong emotional eliciting events in order to alter their emotional impact. The goal is to shift our perspective on a situation to reduce the emotional burden of that situation. And there are 3 key components to that. First, identifying and challenging negative thoughts, recognizing automatic thoughts and questioning their validity. We all have negative thoughts multiple times every day. Most of us don't really pay attention to them, or if we do, we just sort of move on from our life. But in cognitive reappraisal, you're really going to pay attention to your negative thoughts and then start to think about, is that really the way that this particular situation is right now? are the emotions I'm feeling coloring that?
I once had someone share, check the facts. So is that sort of what you're talking about?
I was just going to say that there's a type of therapy I do called dialectical behavior therapy, DBT, and that is a harm. I have that phrase drilled into my head from the woman that developed that, but check the facts. That's exactly right. So once you check the facts, you're going to start to generate some alternative interpretations of those facts. It might not be your first assumption. So you want to find different, hopefully positive, but the very least neutral ways to view the same situation. Then the third and last thing, is you evaluate different outcomes. You have this new perspective, this new interpretation, and you're going to assess the emotional impact of this new perspective. And if it's positive or at least neutral, you'll find that your experience is different in this situation. The fourth is adaptability, which is just related to what we were just talking about, being able to adapt to the changes life throws at us.
Right.
I remember when I was early diagnosed and I was having a bad, very symptomatic day, I would think the whole week's going to be bad. And it would almost become a fait accompli. So I slowly, over time, broke that down to smaller and smaller bits. So now it's not even if I'm start off the day bad, not even the morning's going to be bad. That minute's going to be bad. So over time, I was able to decrease thinking these catastrophic thoughts ahead, which most of the time didn't come to pass.
Right.
But sometimes if we have that attitude, that's certainly not going to help our mental health. And it may certainly, assuming we're going with that mental health does affect physical health, that it can make things worse.
Yeah.
And the last one that might be the most important one is self-compassion, because people are really hard on themselves. I work with person after person that we all do this. This is human.
Yeah.
We say things in our own head about ourselves that we would never say to another person.
Right.
So one of the exercises that sometimes we do in therapy, we'll have those thoughts you're having in your head right now, pretend I'm a friend of yours, and say those to me. You're thinking your friend. People can't do it. They cannot say, for the most part, those really negative thoughts they think about themselves and put it onto someone else. So generating self-compassion and going easy on ourselves is so important to all of this.
I think that's a great tip. And I think to go back to what you started talking about in terms of being self-aware of our emotions and identifying and naming them almost is what I think is amazing about emotions is we think of some of the main ones, right? Sadness, anger, but so many of those can be peeled back and under it is a lot of hurt or feeling overwhelmed or whatever. And so I think being aware of those emotions and kind of where they're coming from is really important to be able to move forward.
Yeah, there's such a thing for all of us with chronic, and we don't all have it, but for those of us with chronic illness, especially that have had a lot of medical procedures, especially ones that start young, like mine started at age 4, is medical PTSD, which is very similar to PTSD in general, but you are right back to something, a surgery or whatever that was happening at an earlier point in your life. So being able to really ground yourself and focus on the present moment can be really helpful in getting you out of that, getting stuck in your past and a negative something that happened in your past.
Okay. That dovetails nicely into sort of talking a little bit about mindfulness, which I know you said is so important. And I think a lot of people don't really know where to start. I mean, we have several easy practices to follow on the website, whether it's sound meditation, yoga, deep breathing. But how do you explain mindfulness and get your patients interested in trying mindfulness activities in their life? Because we're all busy, right? But how do they carve out just a little bit of time to be present, as you just mentioned?
And that's really the trick, is committing yourself to carving out some time every day. It's not that dissimilar when you start an exercise program. You don't just go to the gym when you haven't been there in a while and expect to be able to lift 150 pounds or whatever. So you got to work up to it and you got to practice and you got to keep going back to the gym. Mindfulness practice is the same way. It's not difficult to describe. It doesn't mean it's easy to do, though. The definition of mindfulness, it's the practice of being fully present and engaged in the current moment, aware of your thoughts and feelings and surroundings without judgment. It involves paying attention to the present experience other than dwelling in the past or worrying about the future. So there's three core aspects to mindfulness. One, awareness. That one's self-evident, just noticing what's happening in your mind and body. Acceptance, which is a little bit linked to self-compassion, as is the next one, but accepting your thoughts and feelings. Feelings just happen. They are not inherently bad or good. They're a human response to situations, and they can take control of our lives to the detriment. So part of the mindfulness is observing those thoughts without getting too sucked up into them, without trying to change or resist them. Resisting strong emotions generally doesn't help. In fact, it can, in my experience, just make them stronger. So you just start to observe them and observe what they're really doing in that moment. And the last thing is non-judgment. Observing your experience without labeling it as good or bad. Again, feelings just happen.
Okay.
And there are lots and lots and lots of techniques to do mindfulness. There are stuff on the IgAN Foundation website that can help with that. What I do is meditation. There's deep breathing. There's mindful walking. Meditation isn't necessarily sitting on a cushion for a couple hours a day. It can be going out for a walk, but, not being on your phone, not listening to a podcast when you're walking. You're out walking, you're enjoying the sunshine, you're enjoying the fresh air, you're feeling the feeling of your feet on the ground. So when I tell people to start a mindfulness practice, you don't go and sit there for 2 hours or an hour. You do it in little bits throughout the day. You do it for maybe 5 minutes, and that's it. And then maybe you'll do it another 5 minutes later in the day. And over time, you can build on that and make your time longer and longer. And I guess the last thing is you can't do it wrong. You're going to be challenged because people's thoughts by nature, in the mindfulness world, we call them monkey mind, because our thoughts are all over the place.
Yeah.
And it's hard to tame. So you don't try and suppress them. You observe them and you let them go. And as your mind drifts to something else, you recognize that, and then you bring yourself back to whatever you're focusing on for that period of time. Usually what people start with is the breath. So if you are breathing, sometimes it's easiest if you're just beginning to count with your breath. So you would inhale, count to 1, exhale, count to 2, do that to 10 or 20, and then start over. So as you're doing that and your attention shifts, just bring yourself gently back to your breathing. And you'll have to do that over and over and over and over again, and it will get easier.
So that sounds like almost a good place to start if someone feels overwhelmed by lots of different emotions that they're coping with.
Yeah. I do some belly breathing between every patient. I just spend a couple minutes to regroup myself. So I'm at my most aware and engaged with that patient. So I can let whatever just happened with the previous patient, which sometimes can be stressful to physicians and therapists too, let that go and give my unfocused attention to the new patient.
Yeah, because I think it really does reset. It helps reset, and it helps actually give you more energy, which I think some people don't realize.
Absolutely.
And I love the strategy you're giving people to just do little bits at a time. It's kind of like how we suggest doing exercise. A lot of people don't have 30 or 40 minutes of blocks of time in their day, but if they can do little bursts of, 10-minute exercises here and there, or a walk at lunchtime, it sounds like you could even combine the two and get the most benefit. Well, so you personally live with IgAN and Crohn's. How do you keep perspective and prioritize your mental and spiritual well-being?
That has been one of my biggest challenges, quite honestly, throughout life. And especially on a summer like this one, where both are flaring at the same time, which is new to me. Okay. I have not experienced everything kind of hitting me at once. like they are this summer. So what I've been doing is I'm pacing myself with life. I'm not trying to overdo it. I'm setting boundaries. I think most of us, especially people that get involved with foundations like the IgAN Foundation, the IgA Nephropathy Foundation, we like to be helpful and we like to say yes.
Mhm.
And you don't always have to say yes. You can say no. It's important to set boundaries in your life. I prioritize rest because if I just push myself too much, sometimes by saying yes to too many things, that just makes my flares certainly longer, if not worse. And the last thing I've been doing is I certainly don't compare myself to others, which is very difficult these days, especially with social media, because everyone else's life looks better. That meal looks more delicious than whatever you're having, whatever picture they posted on Facebook. So, all those people are out living their lives and having fun, and here I am sitting at home with flare of my IgA nephropathy. And it's not fair, and that can lead to negative emotions.
Of course,
so I've just had to work at shutting that out of my life, just not comparing myself to other people. And the last, my go-to, and this is also comes from DBT, dialectic behavior therapy, it's called radical acceptance. Sometimes there's just nothing you can do to change things, and pushing back is not going to do you any good whatsoever. So you just have to radically accept things the way they are and do what you can given the situation.
Yeah, it must be hard for you because, you live your days helping other patients kind of navigate this, but you also have to cope, and it's got to be hard.
Yes, well, it's hard for all of us, certainly.
Well, and I think even within our community, people talk about not comparing even where they are in their journey because, depending on what stage you are with chronic kidney disease, it can look very different from one person to the next. Everyone responds to different treatment differently as well. So I think what your advice to sort of kind of at some point kind of shut that noise, I guess, to some extent out.
That's a good way to see it, shutting down that extraneous noise.
So obviously, depression and anxiety are super common among people with IgA nephropathy and other chronic illnesses as well, just given the amount that has to be thought of and planned, et cetera. But what are some of the signs people should watch for, and when should they kind of mention this to their care team?
So I think people generally know symptoms of depression or anxiety, sadness, sleep disturbance, irritability, low energy for depression, worry, feeling tension in your body for anxiety, maybe some rapid heartbeat in certain situations. But I guess what I encourage people to do, especially when they have a chronic illness with at least one or maybe multiple specialists, is to have a trusted primary care provider, because they're the ones that are going to screen you for that stuff. Every time I go to my primary care provider, he does what's called a PHQ-9, which is a 9-question questionnaire looking at depression. And there's one called a GAD-7 that does the same thing for anxiety. So primary care people are always monitoring and screening us for any sort of for those big mental health things, because our nephrologists or gastroenterologists don't do it as much as I wish they would.
Yeah.
One of my things I'd like to do as an ambassador, and I have had very little luck doing this with my gastroenterologist as part of my IBD work, is reaching out to nephrology practices and having them do mental health screenings, just in case they're the only physician that patient is going to see. And it takes it takes 5 minutes sitting in a waiting room.
Yeah.
Then you have to set they get nervous about, well, say this comes up positive, what do I do? So you got to help them develop a protocol on what to do if these things happen. But ignoring it's not helpful. And I guess the last thing is really listen to your friends and family, because they're going to tell you if they're worried about you, if they're worried you're depressed, or if your anxiety is impacting your life with your family and kids. So listen to the people in your life that care about you.
Well, and speaking of the people in their lives, and we've been talking about the person living with the illness, but it obviously has an inevitable ripple effect. So how does chronic illness impact partners, kids, parents, and what's your advice for them in terms of prioritizing their mental well-being as well?
For partners and parents, I found just being open and communicating. Communicating is the big thing. I think it's especially worse for men sometimes, is they just keep this stuff to themselves and they don't want to share it. That does not help. And then it frustrates partners. It frustrates parents because they don't know what's going on with you. So it's important to communicate with the people that are in your life. For kids, it's a little different. And I'm going to finish just talking about what you do with kids as a child psychiatrist. So for kids, and what I did with my own kids is you don't lie to them. Kids will pick that up. So you're honest and you're age appropriate. You're going to talk to a 4-year-old different than you're going to talk to a 14-year-old. You're going to encourage questions. So you're not going to shut down conversation. You're going to acknowledge what, just like you would for yourself, you're going to acknowledge whatever emotions they're feeling.
Yeah.
It may be anger that their parent's sick and can't go to that baseball game. It may be sadness that their parents, may be fear because they don't understand this illness. And they don't know if it's going to kill their parents. So you acknowledge their emotions and you provide reassurance, realistic reassurance, but you reassure them. You involve them in your care. So, not in major ways, but, they can do little things that maybe you would normally do for yourself, but sometimes kids can feel like they've developed some competence and mastery in helping you through your journey with illness by involving them in some of the day-to-day stuff.
Sure.
You want to try and maintain normalcy for them as much as you possibly can, which can be very, very tricky with someone with a chronic illness. Always seek professional support and use resources. There's resource on most of the websites for the foundations for chronic illness. Most have ways to talk to and involve your kids with them. So reach out to your, for IgAN, it's obvious, the IgA Nephropathy Foundation.
Yeah, I think that's super helpful. And obviously for kids especially, the unknown can be a little bit more scary than knowing, right?
Than the known, right.
Well, thank you so much for sharing so many of these tips. Is there anything else that you want to share that you think is important for people to keep in mind as they try to care for their mental health as well as their physical health, which we know is equally as important?
I guess the last thing I would mention is stigma still exists.
Yeah.
And fortunately, it's changing. I know my kids, who are 25 and 22 now, have a very different, and their friends have a very different attitude towards mental health stuff. It's not something to be ashamed of. They're much more open in talking about it than my generation ever was. So stigma it's still there, and it's slowly going away. And part of my job, and hopefully our job as chronic illness patients, especially if we want to advocate for chronic illness patients, is pushing beyond stigma.
Yeah, I think it's so important. Obviously, something that Bonnie, in developing this foundation, stands by. No one should be alone in this. So I think that in and of itself, that sense of a community behind you is really important. I love your thoughts, too, about reaching out to nephrology practices to try to raise awareness about depression screening, because to your point, some folks with chronic illnesses, their specialist becomes almost like they see them more than their primary care doctor, and maybe even have a closer relationship. So I think that's key as well.
Yeah, absolutely. It took me about 5 years to get my gastroenterologist to do it, but you just keep plugging away, and now they do.
Yeah.
There's no reason nephrologists can't do the same thing.
Yes, I agree. And I want to thank you so much for sharing your professional strategies that you give to your patients, but also obviously enlightening us and providing wisdom based on your own journey as well. So thank you so much for being here today.
Well, thank you for having me, and I hope this is helpful.
It's been great. Thank you. And thank you to our listeners. We know this isn't an easy road, and we hope that you can pull some practical tips into your life that work for you. Also, visit our website, IgAN.org, to take advantage of the many tools we have, including our virtual support groups. Thank you for joining IgAN Journey, the IgA Nephropathy Foundation's podcast. Here we share information, practical tips, stories, and inspiration for living with IgAN. Everyone's at a different point in their IgAN journey, but we're here for you. You're not alone. To learn more about IgAN, to get involved, or help fuel our mission with financial support, visit www.IgAN.org. The information and opinions shared in IgAN Journey are not intended to serve as or replace medical advice. Always speak with your nephrology care team about treatments that are right for you.